Why do breast MRIs often lead to biopsies? Imagine a tool so sensitive it can spot tiny changes in breast tissue that other scans might miss. That's what a breast magnetic resonance imaging scan does. It uses magnetic fields and radio waves to create detailed pictures of the inside of the breast, especially helpful for women at high risk of breast cancer. These women might have a strong family history, genetic mutations like BRCA1 or BRCA2, or previous breast cancer. Because MRI can detect subtle abnormalities early, it's a key part of prevention and early detection strategies. But here's the interesting part. When an MRI finds something suspicious, doctors usually can't tell right away if it's cancer or not. The images might show an area that looks unusual, but that doesn't mean it's definitely cancer. This is because MRI is very sensitive and can pick up benign or harmless conditions that look similar to cancer. To be sure, doctors often recommend a biopsy. This involves removing a tiny piece of tissue from the suspicious area and examining it under a microscope. It's the only way to get a definitive answer. The chance of needing a biopsy after an MRI depends on why the scan was done. If the MRI was ordered because of symptoms like a lump or nipple discharge, or because an abnormal mammogram was already found, the likelihood of finding cancer is higher. That's because these scans are done when there's already some concern. On the other hand, if the MRI is part of routine screening for women without symptoms or known issues, the chance of detecting cancer is lower, but biopsies can still happen because of the scan's high sensitivity. Research shows that about 29% of biopsies guided by MRI find cancer. But this varies depending on the situation. For women already diagnosed with breast cancer, MRI can sometimes reveal additional cancers in the same or opposite breast, leading to more biopsies. Many biopsies, however, do not find cancer. Instead, they may reveal benign conditions or high-risk lesions that need monitoring but are not cancer. Because MRI is so sensitive, it can also detect benign findings that look concerning but are not cancer. These are called false positives. While false positives can be reassuring in the sense that they are not cancer, they often lead to biopsies that turn out to be unnecessary. This is a trade-off. MRI helps catch more cancers, especially in women at high risk, but it also results in more biopsies for benign findings. In women with dense breast tissue, MRI can be especially helpful because dense tissue makes it harder to see cancers on mammograms. But this also means more biopsies might be performed without necessarily finding more cancers. That's why careful patient selection and shared decision-making with healthcare providers are so important. In summary, breast MRIs often lead to biopsies because they are very sensitive and can detect tiny abnormalities. While this helps find cancers early, especially in women at high risk, it also means many women undergo biopsies for benign issues. Deciding whether to have an MRI and what to do afterward should always involve a discussion with a healthcare professional. They can help weigh the benefits and limitations based on individual risk factors and preferences. Remember, MRI is a valuable tool in a comprehensive approach to breast health, which may include other tests like mammograms, ultrasounds, and genetic counseling. Always talk with your doctor to understand what's best for your personal situation.